Hi, everyone. Welcome to Prevention Education, the podcast that teaches you everything about prevention. Thanks for listening, and let's get started. Hi, everyone. Welcome back to another Prevention Education episode. As always, I'm your host, Kylie, and today I have Laney on with me. So, Laney, would you like to introduce yourself?
Yes, thank you, Kylie. I'm Laney Partin, and I'm new here at the prevention department at Preferred Family Healthcare. I'm part of the MHAT grant, so that's mental health awareness training, and I'm the specialist of the grant. So we cover the top 27 counties in Missouri, and we provide mental health awareness trainings to businesses, communities, and those can be public or private. Yeah.
Yeah, we are so lucky to have Laney on our team. I know even though she's new, she has done a fantastic job with just diving into the work. So we're happy to have her. So to get into our get to know you question, today's a fun one. What was your favorite game as a child?
Okay, so I played softball up through I started at T-ball at the youngest age and then went all the way up through high school. I remember whenever I played softball, like just starting, I was playing T-ball and I was playing on the field somewhere and I got the ball after the batter had hit it, and I actually threw the ball at the batter, like, thinking that maybe that would get them out. However, it obviously did not. But I remember that got quite a chuckle out of the crowd, but
Yeah, that's
yeah.
amazing. I actually coached T-ball a few summers ago, and truly, like, the confusion that happens is the best thing to watch. Like,
Yeah.
it's truly the best thing.
Yeah, I wasn't the one in the back picking the grass or playing in the dirt. I was the one throwing balls at people trying to get them out, so
Yeah. Hey, it's easy to mix that up. My favorite game as a child, this is a really weird game, but we used to play this game called the sewer game, and we lived in a cul-de-sac, and so the sewer in the middle was like our base, and then you would have a protector of the sewer, and you would have to like run to get on base, but if you got tagged, then you became a protector. And I don't know if we just made this up. I don't know if we got it from one of our parents, but it was truly like the most fun game as a kid. And then when
Well,
we
that
moved, we were
that's
so sad. But
that's quite creative. I gotta give it to you. That's pretty creative. My
yeah,
cousin and I my cousin and I, we would drive around on my grandma's golf cart, and she lived in the country, so there was, like, buzzards and everything everywhere, and we would stop the golf cart and, like, play dead for a minute just so we could, like, see the buzzards come around, and then they would go away.
oh
So
my
that
goodness.
so I understand the creativeness there.
Yeah. If you don't have, because we're not too old, but when we were younger, we didn't have like all the technology yet. And so it was
Right,
still come up with something to
right.
do to keep
Yeah,
yourselves entertained.
yeah,
So,
parents would still kick us outside.
yep, exactly. Exactly. So now that you guys know a little bit more about us and just the fun childhood that we had, we're gonna hop into a pretty serious but also like really educational topic for our listeners. And it's about risk and protective factors. Um, and so, like Lainey mentioned, she's a part of the Mental Health Awareness Training Grant, also known as MHAT. So if you hear MHAT, that's what it is. But in MHAT, the risk and protective factors play a huge, huge, huge part, kind of our prevention in MHAT, I guess. Delaney, would you mind kind of explaining what risk factors are to start with?
Absolutely. So risk factors are attributes that contribute to the development or worsening of undesirable conditions. An example of that could be familiar conflict, social isolation. My goodness, um, any of those might increase the risk of mood disorders or manipulative behaviors such as drug or alcohol use or consumption. Um, but protective factors can kind of outweigh those and balance everything out.
Yeah. And so what are protective factors?
Protective factors are attributes like life skills, strengths of resources that help shield an individual from risk factors and from development or worsening undesirable health conditions and enhance their capacity to cope. So, having a great social network, skill development, proper nutrition, adequate sleep, physical activity, those are all protective factors that kind of make the risk factors bounce off. And risk factors can include mental health challenges, any kind of mental health or medical condition, um, stress of education, anxiety, depression, use of alcohol or drugs, and conflict with friends or family.
Yeah. So with risk and protective factors, what trainings do you guys have that talk about these? I know the answer, but for our listeners, what do you guys have to offer to kind of help bring knowledge on this topic?
Yeah, so specifically if somebody would want a training in risk and protective factors, and we would talk about resilience, that would be a mental health workshop, and that would be about 45 minutes to an hour. Um, and we can do our trainings virtually or in person, but it would just be a presentation or PowerPoint specifically made for that topic. We also offer mental health first aid in adult and youth, and both of those also talk about protective and risk factors and how those are going to affect someone's not only child and adolescence, but as an adult as well.
Yeah. Yes. And so if you're listening and you're interested in any of those trainings, if you head over to our website, pfh.org/prevention, you can email Laney or our manager, Mary Dent, on the grant as well. And I will also include Laney's, I almost just combined both of your names. I'll include Laney's email in the description of this episode as well. So feel free to reach out to her for any of those trainings. They're all really great, full of really great
Yes.
information. So thank you for sharing all of
Yeah.
that.
Yeah.
And one thing that I kind of want to dive into with what you just said, you brought up how adults and youth
Mhm.
can benefit with someone else knowing protective factors and risk factors around them. So what are some examples, I guess, in the youth community where risk factors or protective factors can come into play?
So, if a child experiences or witnesses abuse, or say a guardian or a parent is a substance user, that is going to be a risk factor of their life, but that could be static or temporal. So, if that child were to have an intervention, then those things could be um, coped with, and you could build resilience and build protective factors to shield from those risk factors and build more power against them, I guess. I don't really know how else to explain it.
Yeah.
Um, but I don't know. Okay, so I guess the way that I kind of see protective factors and risk factors is, say you're standing on a platform of resilience. You have this shield around you, and the shield is your protective factors and everything in it. And then all of the things on the outside are your risk factors. You want those risk factors to just bounce off because those protective factors is what you need to be a successful child going into adulthood and an older age.
Yeah, I think that's a really good example. I think sometimes it's hard to grasp how these ideas, these concepts kind of play into our lives. And so kind of
Mhm.
picturing that bubble, I think is really awesome.
Yeah, that's
And
how I understood it and how I best learned it. So I don't know if that's going to help others. I hope it does.
yeah, oh, I'm sure it will. That's a really great way to put that.
Yeah.
And even if a risk factor kind of gets in your bubble, those protective factors can help to push it back out. And so
Right.
surrounding yourself with those protective factors, a loving family, even one caring adult can make the biggest difference and can help push out a bunch of risk factors. But
Exactly.
um, yeah, I think just surrounding yourself, and I think a lot of people know this, surrounding yourself with positivity, the right avenues, like that's all of our goals, right? Like that's the dream, to have everything kind of perfect, make sure we're well protected, don't get anything bad in.
But it
Um,
happens to everybody. I mean,
exactly.
everybody experiences positive and risk factors, whether we realize what they are or not, does happen to everybody.
Yeah, very true.
An example
Um,
I thought of was, say you move to a new city, that could be a positive or a risk factor. So it could be a risk factor if you're moving away from somebody that you're really close with or family,
yeah,
you know, but it could be a positive or a protective factor if you're moving closer to family or friends. So
yeah,
every situation, every scenario is going to have some part, you know. So yeah.
yeah. That made me actually think, which this is a little funny. I'm currently watching Parks and Recreation right now, and the episode I just watched, one of the main characters was moving away. And so
Hmm.
she's leaving her best friend, she's leaving the community that she's had for years. And so that might be kind of a risk factor coming into play where you're leaving a lot of
Yeah.
people you love. But the protective factor is she was moving to a place where she has family, she knows it really well, she grew up there, so she still has support there. So it kind of balanced out, which if it if it balances out or the protective factors are higher, that's what we aim for.
Yep.
You don't
Yep.
want the
That's the
risk
goal.
factors to ever weigh a little more, I guess.
And if they
Um,
ever do, which it happens,
yeah,
that's whenever you want the intervention. That's whenever you, as a friend or a family member or someone that you care about, if you see that someone may be experiencing something like this, and we talk about these in our trainings, you may want to reach out. You may want to say, "Hey, you know, when was the last time you talked to a family member about this, or your primary care provider?" Or just kind of checking in on them on the basics of when was the last time you showered, you ate, you know, took care of yourself, did some self-help strategies and um yeah,
yeah. Just showing you care is the biggest
right. And that
protective
could
factor
be
of them all.
a phone call or sending something in the mail or a post or anything like that.
Yeah. Very true. I think right now, since we live in such a technology-based world, there's really no excuses. Like you can send
Mhm.
something and they will get it in 2 seconds. And
Right.
so I know we always use the excuse of I'm busy, I don't have time, but
Mhm.
it takes no time to care for
Right.
someone. Just showing them that you care is what matters in the world.
Yeah.
So yeah, that's
Um
really important.
Another example that I just kind of thought of because I'm currently going through it is I just had a friend that just had a baby. Um, of course, it's great news. Congratulations, you know, it's the best feeling on earth. But labor can be mentally draining, not only physical, but mentally as well. And sometimes it may feel like people are checking in on the baby, but not mom. So I made it a point to tell mom, you know, hey, like if you need to talk, if you need anything, I'm here and I'm going to take a dinner to her sometime this week, you know, just so she doesn't have to cook, she doesn't have to stress. So just little things like that are going to help those potential risk factors, you know? I mean, I don't even know for
Yeah.
sure if she, you know, what's going on in her head or whatever, but just so she knows I'm there and I'm a friend, that is reassuring and that gives her the protective factor of a positive social network.
Yeah, very true. And I think there's kind of two different types of protective and risk factors. You can either have the early intervention, or you can come in after something has occurred.
Correct.
So with early intervention, that's kind of where we're targeting the younger individuals, the youth in the community. And so with early intervention, you want to make sure they know, hey, substances might come into your life, but in order to combat substances, you can talk to adults and you can look up the facts and see how that's going to harm your body so that you can outweigh um, the positives with the negatives, I guess.
Right.
I mean, that's a
Yeah.
weird way to say that, but so that's kind of where we're focused, is that prevention, that early intervention. But in a lot of situations, there is no early intervention and we're a little bit later in life. We already have a lot of risk factors associated with our everyday life. But getting protective factor, it's never too late to get protective factors in your life.
Right.
And it might seem sometimes like with some mental health struggles, it might seem like there are no protective factors around you. But I know it can be really hard for some people, but just kind of trying your best to find those protective factors, and like like what you did for your friend, just having a friend to maybe highlight those protective factors for you as well, and just having people, even if you don't feel like you want to be around people, having those
Yeah,
people are your protective factors. And
exactly.
so being older, might feel like you don't have any, but it's never too late to start building those up.
To gain
Never
some
too
new
late.
ones. Yeah.
Yeah. Yeah.
Yeah, I agree 100%.
Hmm. Um, this kind of goes back to something you said earlier. You mentioned the words static versus temporal.
Mhm.
Can you kind of explain what that means?
Yeah. Um, Give me 1 second.
No problem.
Gotta find it in my notes. Yeah, so, protective and factors can be static, meaning that they do not change. These factors are fixed and will remain constant throughout one's lifespan. And that could be a medical condition or a mood disorder. And it doesn't say here how to kind of cope with that, but I think we've already kind of touched on it a little bit. But say you are a person that lives with or experiences depression or anxiety or any other kind of mood or mental health challenge, um, doing what you need to do to take care of that, whether that's self-help strategies, seeing a therapist or counselor, medication, whatever you need to do, those are going to help you build resilience and build protective factors for those static risk factors. And then protective and risk factors can be temporal, meaning that they can change. Interventions are most effective when targeting temporal factors. And like you had said earlier, temporal risk factors or temporal factors in general, it's going to be more beneficial to catch those early on. So you can catch those early signs and symptoms and get that intervention as soon as possible. And that's where you're going to see the best outcome.
Yeah.
Um, Temporal protective and risk factors fluctuate as an individual's life circumstances change. And again, that's like the moving situation. So that, I mean, things like that come and go. Money comes and goes. Friends and family come and go. Life, that's just life is a bumpy road. So there's positive and negative to all of that.
Yeah. Yeah. Thank you for sharing all that, because I completely forgot what those meant too. So
Yeah.
I'm glad that our listeners can get that information.
Yeah.
Um, uh, Another question that I had, and I don't know, I just like read an article on this a few minutes ago. Um, During this actually, like brought it up really fast. Universal, selective, and indicated prevention interventions. Do you know much about those?
I'm not super familiar with them.
Okay, I just wanted to kind of bring it up with risk and protective factors. So it's SAMHSA that put this out with their description of risk and protective factors, and the universal prevention intervention. And I feel like we do all three of these without knowing it, but I think it's good to kind of put a name to what it is. So the universal prevention intervention preventative intervention. That's a tongue twister. It's when the broadest approach is taken. And so that's kind of like our entire department, our meaning our prevention department. And so we all put messages out there, and we might put some risk and protective factors on a post. We might throw some of the 40 developmental assets out. And if you don't know what those are, there's another podcast if you're listening. there's another podcast about those, so be sure to listen to that one. But this is just like a big target. And so that's our social media, that's flyers, all of that that has the information on it. And then it moves to selective intervention. So that's where we target biological, psychological, or social risk factors that are more prominent in a certain group. So, say we have a high school that reaches out to us that says substance use, specifically alcohol, is really big in our high school. Can you come and talk to us about how to kind of combat that with protective factors? That's more selective. And then we go into indicated preventative interventions. I don't know why I'm having such a hard time saying that. But that is then targeting individuals. So that is one-on-one with friends, with any of our specialists in our department. And I think you guys in MHAT, you guys do all three of these really well, in my
Mhm.
opinion. You do the broad approach, you do certain groups of people, and then if anyone ever has a need, I know they can email us and you guys work with them to try to get them the resources, the help that they need. So just when I saw that list, I thought about how we do all of those. And I didn't realize that there was actually like names to all of that.
Yeah, that's
So
great.
yeah,
Um, we do cover all of that. So initially we promote our trainings. We'll tell you what we do. We'll give you our little spiel and try to get you to just come sit in on a training. And then once you decide that you do want a training, then we'll make you your flyer that is going to have a few specific details on there. And then you will also help us with our flyers. And then in the initial training, you're going to get even more details. We're going to talk specifically about those signs and symptoms that we're going to be looking for somebody experiencing or living with any kind of challenge, whether that's a disorder or, yeah.
yeah, yeah. And you guys truly do an amazing work with what you do and make a huge difference in our community. So
Yes, we
um,
try. Thank you.
yeah. So, kind of coming to a close, is there any other topic you wanted to mention about this? And I will also ask, just so you can be thinking about it, um, if there's one statement that you have for our listeners to kind of end with. So, is there any other kind of topics you want to dive into for our listeners?
I just wanted to push that our goal is to save as many lives as possible. We have a variety of different trainings that we do with the mental health first aid, the workshops, and the suicide prevention training, which is QPR. Um, and we just want to get out there in our community and do our best to help people who need it.
Yeah,
Even coming into this environment and work setting, it was very eye-opening with my personal experience of mental health challenges, and it's it's very needed, I feel like, especially in rural areas. Um, it's nice to, be able to relate to some things and know that it's okay and know that it's normal and know that there are options out there to help cope and know that not every mental challenge is, permanent, or you don't have to live with it for the rest of your life. Like, you don't have to go to a therapist or a counselor the rest of your life, just for depression. That could
yeah,
last 6 months and then you're done and you have permanent coping skills to use for the rest of your life. So
yeah,
the stigma of mental health is horrible, but we want to push that it is so important to recognize these signs and symptoms of somebody experiencing a challenge and to help them as much as possible. And if you don't know how to help, then we can teach you.
yeah. That is a wonderful way to put that. I think you said that flawlessly. So with all of that, if you have one statement that you would want to leave everyone with regarding risk and protective factors, what would it be?
Everybody has them.
Yeah,
Everybody has risk and protective factors, whether that was, in your adolescent years or if that's in your adulthood or older age. Everybody experiences them, and learning how to cope and live through them, can be difficult, and we want to teach you how to do that.
Yeah. Yeah. Well, thank you so much, Lainey, for all this information. I really hope that if you're listening, that you learned a lot today that you can either apply to your life or maybe to someone's life that's close to you. And so feel free to share this podcast with absolutely anyone that you think needs it. And we just really appreciate that you took your time to listen to this podcast today. And Lainey, I appreciate that you took time out of your day to record this podcast with me. So thank
Yes.
you.
Thank
Um,
you.
yes. And listeners, I hope you guys tune in to another prevention education podcast. I know I mentioned the 40 developmental assets one, so if you're still kind of worrying or not worrying, if you're thinking about that one, be sure to listen to that. And we look forward to having you guys listen on to the rest of our podcast. So thank you, everyone. And we hope you have a great day. Bye,
Yeah.
everyone.
Bye.
Thank you guys so much for tuning into our podcast. Remember to follow us on social media at PFH Prevention. You can find us on Instagram, Facebook, Twitter, YouTube, and Spotify, and more podcasting platforms. And make sure to email us at moprevention@pfh.org with any questions, and feel free to call us at 660-627-7404. Thanks for joining us, and have a great day.